The education sector stakeholders have expressed grave concerns about the insufficient health infrastructure in secondary schools across the country. This comes after the unfortunate deaths of two senior high school students in separate incidents due to alleged negligence by school authorities. The Executive Director for Africa Education Watch, Kofi Asare, stressed the urgent need to reassess health systems in secondary schools during an interview with Citi News.
Earlier this month, Stacey Ochre, a first-year student at a Girls Senior High School, tragically passed away after reportedly being denied medical attention by the school nurse despite complaining of severe stomach pain. Investigations into her death continue, while similar incidents have occurred at Akim Swedru Senior High School in the Eastern Region and Kauhen SHS in the Northern Region. As concerns over this troubling pattern mount, Africa Education Watch underscores the necessity of overhauling health systems in secondary institutions.
It appears that teachers and school managers and those who man the sick base use their discretion when such issues emerge. Why? Because we haven't taken adequate, attention. Taking adequate notice of and giving attention to health systems in our schools. Many schools do not have sick bays that are functioning well. Many schools do not have competent personnel manning their sick bays. Many schools do not have medicines at their sick bays. NHS is not working in many sick bays, so you have to pay cash. We know all of this. Okay, so it is important for the Ghana Education Service to institute a comprehensive audit of all health facilities and systems in all the senior high schools. And on the back of that report, initiate reforms, resource the health centers with the requisite medicines, requisite staff through collaboration with the Ghana Health Service, of course, and most importantly, ensure that all health centers in schools or sick bays have readily available vehicles to transport students to the nearest health facilities.
Kofi Asare also advocates for the implementation of a case management protocol to govern healthcare delivery in schools.
There must be case management protocols in the Ghana Education Service to be used by all senior high schools. And such case management protocols will simply detail what everyone within the health case management value chain needs to do when a health case emerges in our schools, from the health prefect to the senior housemaster to the sick bay attendant to the housemaster or whoever is responsible to ensure that the child is taken to a hospital if the disease is not within the control of the school sick bay. This must be a well-documented case management protocol, such that whenever an issue emerges, it is easily to diagnose within the case flow where lapses may have occurred.
Meanwhile, Bright Appiah, the Executive Director of Child Rights International, calls for severe penalties against authorities found guilty of negligence.
One of the things that we've also been not able to do has to do with holding people responsible for things that happens in the school environment. As you've mentioned, it has happened so many times, but we have failed to take a drastic action against those who sleep on their responsibilities by neglecting the very right that they have to protect and all that. It happened in Wesley Girls. It happened in Holy Child. It happened in Achimota recently. We are still in court. We don't got any ruling in respect to that. And then it is happening now. So if we are able to hold people responsible, we will design a system in such a way that we have to hold them responsible and accountable for the souls that we have entrusted in their hands and the students that we have given to our schools. So it's a whole system regime that we have to change.